Namaskar, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Today we're going to do the sense of smell. And then one after that will be the sense of taste, and we'll have completed our series.
See, this olfaction, that sense of smell, is through the nerves or neurons which are present in the nostrils, in both the nostrils. And the mucosa of nose is rich in the nerve supply. And these neurons, they are projecting and they sense the air entry into nostrils, and then it is analyzed by brain to perceive the smell. Now, the hypothesis is that whatever is around you, the influence is diffused. Not necessarily the molecules are floating or they get diffused, but it is the influence of the liquid or solid or whatever matter is emitting smell that gets diffused all over. And by analyzing the air, our sensory nerves in the nostrils, they sense the smell, and that is analyzed. So even because of intensity of the smell or the type of smell, person can even perceive even the direction from which the smell is coming and the intensity, and by experience one can even sense like what is it, the object. For example, you see, we have the fire sensors. Actually, it detects the smoke. And based on that, one can sense whether there is fire. Even our human sensory nerves in the nostril can sense that what, like, it can work like smoke detectors. If suppose some wiring is catching fire, so our nostrils can sense that fire by smell of the smoke or some wire or the insulator getting burnt, and based on that one can. So it is wonderful defense roused by our olfactory sense. Even suppose some dead animal is around, and it is getting decayed, and that rot smell also can be sensed by our nose from the direction. I remember, see, these lower animals have special capability of sensing, especially our pet dog. It can sniff things from far distance where our human nostrils can't. So if someone is having a handkerchief which is used around the body, and that we just give it to sniffer dog, and that dog can sniff it and then identify the person even at few kilometers away, and in whatever direction the person has gone. The person may not be there, but the person has just gone in that direction. The sniffer dog can sense it. Now, it is such a ultra sensitive apparatus that our machinery can't verify it, whether it is right or wrong. But the dogs, it is verified fact. That's why the police are using the dog squad for detecting the bomb and explosives, and even the robbers and thieves,
And drugs also.
and drugs also.
Yes.
So because those dogs are trained. Same way, our human olfaction, it somehow both the nostrils, they are enriched with the presence of the nerves which protrude out and analyze the air going, and in our central system that impulse is carried and that is analyzed, and then you are put at guard, like depending upon the smell. Even lower animals, they also can smell through skin. For example, this earthworm. Earthworm, doesn't have eyes to see, but at the same time, it analyzes the air circulation around it, and based on that, it can sense where the food is there and it can approach the food. So this sense of smell is very important, and recently people started using it just to diagnose the COVID. In COVID, surprisingly, the person who is affected by COVID used to lose the sense of smell as well as sense of taste. And just very symptom that the person gets anosmia. The loss of smell is called anosmia. So anosmia and the loss of taste. Person used to suspect one to have COVID and then approach the test, and they used to get it confirmed.
Well, I have two questions for you. The first one is about the perfume makers in France, especially, and how they could detect the subtlest perfumes.
See, perfume industry is, nowadays very much aware that, see, some perfume or strong odor, bad odor, it's very, sharp. There is no sharp line between that. Some people find it unpleasant. Some people, even faint with that perfume. They develop even breathlessness. Now, this perfume industry is very particular about it for human susceptibility. In the sense, the perfumes which make the pleasant feeling in the person after olfaction, that is supposed to be the best perfume. Otherwise, some perfumes they can provoke what we call respiratory distress, and the person may react wrongly. So I remember, like, this Osho used to deliver a lecture, and he had allergy for all these perfumes. So they used to keep two persons at the gate to sniff the person, and if someone is wearing a perfume on body or perfumed oil, they used to just send them back. In spite of buying the valid ticket, they were not allowed to enter. And it used to be 5,000 people, crowding in the auditorium, but not even one was allowed, because maybe he was so sensitive that even one person with a perfume enters that hall, he used to suffer. So they were very much particular about it. So this perfume industry also is very particular about the fragrance, what it gives should be palatable to the human sense.
And the effect of it.
Exactly.
Yeah,
So it should be palatable, and a pleasant feeling should come.
Next question I have is, what about when the nostrils are blocked? We had talked about that.
Yes,
one
we
time.
have. We have cases where there is a hypertrophy of mucosa. When the mucosa is too much congested or hypertrophied or inflamed, also with congestion, then the loss of smell comes, anosmia comes, and it's a normal feature in people with chronic rhinitis. So when we start treating them, the recovery of this olfaction sense is the sign of healing in such cases. So we have like cases where it took about 4 to 5 months to recover their sense of smell. So the hypertrophy of nasal mucosa can affect olfaction, and some people, they don't just can't smell anything, and it's really disastrous for the person if can't smell anything.
Can they be cured of
Yes,
this?
it is reversible.
Almost, it is reversible.
It is reversible. It is reversible. The underlying cause of congestion, mainly it is allergic response. If that is treated well, and of course it much depends upon lifestyle. We have seen, especially younger age people. We generally, as a homeopath, we don't get fresh cases. We get cases where they are handled by so-called ENT surgeons and allergy specialists and all, and then they come after SMA surgery or polypectomy or even sinus drainage and all. But then we have seen that we, first of all, we take it that it is not a local malady. It is a compensatory phenomena where the nose gets blocked. So what we do is, we see that the person sleeps properly in proper circadian rhythm, then has a diet which doesn't cause any indigestion or allergic reaction, and sun bath, and we check the vitamins and we give natural vitamin supplements and all, and we see that the person recovers. We don't treat the local pathology as a
Ah.
congestion in the nose, but we just eradicate the things which promote this congestion, because congestion in the nose is a compensatory phenomenon. We have demonstrated this where the person has blocked nostrils and you just ask the person to walk about, toss about, walk about in a brisk walk, and the nostrils open.
Hmm.
So it is again a sort of a compensatory phenomena body undertakes. So we treat that with homeopathic medicines and of course the correction of lifestyle, and it does help, and it's completely reversible.
Now, I had mentioned to you one time that when I was studying music, that the doctor, and he was ENT, and he said that I had so many bones in my nose that they would have to be cut out. And I believe you told me that wasn't necessary.
Yes.
And it was
See,
my most
those are
painful
not
surgery.
extra bones. Actually, those are all bony callosities which grow as a hypertrophy or as a compensatory phenomena. So it is not like some new bone has appeared there or something. It is the cartilage and the bony tissue which gets callosity and deposits and grows it as a compensatory phenomena. So it is absolutely reversible. It is absolutely reversible. If the underlying cause is gone, no irritation, body doesn't need to compensate it, and then body realizes that it need not be maintained also. So it gets absorbed. In homeopathy, we have seen even the hard corns in the plantar region, they get absorbed. Even the ganglion which develops in the wrist, that also gets absorbed. We have seen even without treatment, it has reversed. You just correct the lifestyle. There is no reason why body needs to compensate it by hypertrophy or some phenomena. It reverses. It reverses.
And when someone is having difficulty breathing through the nostrils,
That's what. There are various underlying pathologies which are responsible for this difficult nose breathing through nose. So, for example, nasal polyp. Now, there is a case here with us where the person who is around 65 age, he has a polyp. And ENT surgeon said that you just remove the polyp and you will start breathing properly. But funniest part was that he used to have this breathlessness or nasal obstruction only for 6 months in a year. So where polyp would go for 6 months? So polyp has been there. But why the person is having nose block tendency only for 6 months during certain season? So we convinced him, we started treating him. And the first thing was that the polyp is same but no nose block. Now throughout the year he doesn't have nose block, he breathes through nose properly and he has the polyp. Now then of course initially in initial counseling only we tell that we will treat you for having nose block, and maybe that nose block is contributed by polyp, or maybe the nasal congestion has contributed to formation of polyp. We don't know what is primary, but we will treat you on the basis of totality, and in due course body will reverse the phenomena. So functionally his polyp is cured functionally, in the sense his nostrils are patent now, both the nostrils, they are patent, and he doesn't have difficulty in breathing, whereas the polyp is there. Now he says polyp I don't mind, so why to come to even homeopathy monthly once for medicine? Let polyp be there, I am fine with both the nostrils patent, and I am breathing well. And last 2 years he meets me and reports that my polyp is there but I am breathing properly. So this is how it happens.
how does he distinguish that he's breathing well? How does he know about the polyp?
Patency. See, polyp too can be seen
Ah,
with a naked eye. You can just see. And breathing, he knows that both the nostrils are patent and he's breathing not through mouth, through nose. So what else
Okay.
you need to investigate in that?
Wonderful. Anything else you might add
Yeah, this
in
sense
some
of
of the
smell.
cases that you've had?
Yes, the sense of smell. I remember that some people, they even don't realize that they have lost the smell. But once like you give them coffee or tea, they can't make out what it is by smell. They have to just taste and then tell. So these people, they really are happy because they have come to us for different reason, like sinus headache, sinusitis, and the coincidental symptom is loss of smell, which even they were not bothered much about it. And when we started treating and they started smelling things, you can see the joy on the face of the person, you see.
What about allergies in this case, nasal?
Yeah, these allergies can lead to this nasal congestion and anosmia, definitely. And again, like see, one can be not allergic to something for a while and then become allergic. So allergy is something which doesn't depend upon the allergen, but it depends upon our own reaction to the allergen. So someone else may not be allergic to this phenomena and allergen, and others will be. Few will be allergic. So here the best thing is you have to treat the person who has developed allergy against some antigen, allergen. So there is no point in detecting to what you are allergic. We have to just treat the person to moderate the sensitivity. It's a immoderate or exaggerated sensitivity. Allergy is something like this, that it is hyperimmune response of the person in that sector. So the best way would be to treat the person for having this hyperimmune response and moderate it, and homeopathy has wonderful drugs. But we have seen that even people with a healthy lifestyle can build this moderation. They can achieve this moderation by having proper sleep, proper diet, proper hydration, and proper vitamin D synthesized because of with exposure to sun rays, natural sun rays. This can be achieved.
So, one last question. Excessive sneezing.
See, excessive sneezing in case of maintaining cause is physiological. Like if there is some old, mites there, like old things which are in dark, or the grains which are spoiled in the storeroom, and if that does you are exposed to that dust, definitely there would be sort of a reaction offered by the body in the form of sneezing, which is physiological. Even 10 people are exposed to this dust, they will sneeze. But if it is exaggerated, which is like a hyperimmune response, then it needs to be treated. Otherwise, every nose will have bouts of sneezing on provocation. But some people develop sort of oversensitivity to certain dust particles, especially the dust which has mites grown on it, especially the dust which is in dark places, because ultraviolet rays in open area will not allow these mites to grow. So that dust you don't get affected much, but the dust which is like a old cotton cloth lying in some dark place for weeks or months, that will have mites growing on it, or the carpets which are not cleaned properly, and those mites, if one has exposed to such dust, one will develop sneezing for a while, for a few minutes. But once you are out of the maintaining cause, then you won't have. There you don't need treatment. We call it indisposition, where because of provocation you have developed sneezing. Otherwise, you don't have any issue. But if it is a chronic, like once you are exposed and for days together you go on sneezing, that needs treatment. That needs correction.
Thank you so much. Namaste.